Dr. Richard Buckley and team, MilfordMD. As promised, another episode in what do we do with gynecomastia? That would be male breasts. Typically a combination of fat underneath the skin and glandular tissue underneath the nipple areolar complex, pushing things out. Today, our patient's been awake, and you did fine?
Yep.
Yep. That's a yes?
Yes.
Yes, that's a yep. And so some people get gynecomastia just from genetics, and sometimes people take supplements as part of their workout program, or there might be some hormonal issues. Those are probably the top three reasons people might have some enlarged glands and or extra fatty tissue on the chest. Of course, you know, excess weight can do that same thing. So today we did tumescent anesthesia. So our patient's chest was numbed. As you heard, he's been awake the whole time. And we did microcannular power-assisted liposuction. It means I used, you know, tiny tools, like that's a tiny tool, and suctioned fat out from the area that I outlined. After that, we made a little curvilinear scalloped incision at the bottommost part of the nipple areolar complex, known as the semi-lunar incision because it's like part of a moon. And we went in there, found the glandular tissue, which in our patient's case was a combination of glandular tissue that had a bunch of fat in it. And we got that glandular tissue out, surgically removed it, sealed things, put the tissues back together down deep so that there wouldn't be any dished out area from the tissues that we removed. And then I put some stitches under the skin, and then a few leveling stitches on the skin, and then I put some surgical grade crazy glue on the skin to provide some further support. We'll see our patient tomorrow and just bless him and make sure everything's good, which knock on wood it always is. And he'll wear a little compression binder to put a little back pressure on this. And I don't expect he'll ever have any problems with this ever again. So that's pretty nice to have something that we consider to be permanent It's fixed. Cool?
Yep.
Yeah. Any comments, team? No? Team had a good time. I hope you had a good time. Yep. And our patient's able to jump up and go because he didn't have any general anesthesia, so he's absolutely, you know, full of energy, right? Okay. Thank you for watching another episode of Milford MD.